while this is a coffee hour, we are extending by another 15 minutes and hoping that some of you or most of you can stay until 5:15. So please make use of that time. Yeah, what we'll do is I'll just do a quick round of intros on CoreNet where we're at the moment, and then we'd have Sangath present their study on isolation and have Population Foundation of India, then share a little bit about the work that they've been doing around young people in India, and then we'll have a good 30 minutes to have discussion among all of you people. Great. So very quickly, a quick recap. CoreNet is now more than 50 members that work across 23 geographies. There are over 80 projects that are submitted. You can see all of them on www.corenet.in. Most of you will have access through login details for some of the projects that are only accessible to members. So in case you don't have them, reach out to us and we'll share them with you for you. We also have an active community on Slack with over 200 individual members and a series of ongoing events that we've been doing. As most of you would have gotten individual emails from either Nitya, Ayushi, or myself, please update your studies, and it'll just be great to learn about how studies have progressed in case there are research outputs out, and also in case there are new studies you want to share with us about. I'd also like to share with you another piece of information that I guess came through in a lot of dialogue that we had over the last couple of months, which is around the CoreNet conference. This is tentatively scheduled for the end of March. And we're right now in the process of thinking through what we'd want to talk about and how we'd want to program this, but largely it's going to be about 4 days of learning and exchange, where we're going to connect learnings from the past year across different themes, deliberate how learnings influenced policy and what conversations were across policy stakeholders. Also think about what these learnings mean for future research. And finally, how even within research practice, there's lots to learn and take forward as we move along. And this will be not just for researchers and foundations, but also the wider policy community. What we want to do is we totally realize that we've had quite a massive sort of overflow of information via Zoom. And what we want to do, particularly with this conference, is try to make it more fun and engaging for all of you. So there won't just be plenary sessions, we'd also do workshops and roundtables and showcase booths and networking, but in multiple formats. So it wouldn't just be one to many, but also smaller formats that we try to experiment with. And we hope that that would make it fun and engaging for all of you. And additionally, we're also trying to think about programming performances, so not just purely academic exchange, but to think about what are other dimensions of learning and exchange that we can talk about. So far, I mean, this is a very, very rough sort of draft of what this looks like, but really what we want to do is over the first half, or have one half talking about community sessions where researchers speak with each other, which is much more sector agnostic, where we could talk about ethics, cross-cutting issues such as gender and process and practice. And in the evenings, have more specialized programming, which will be public plenaries around 4 broad anchors that we're thinking about. Again, this is very TBC, but broadly around essential health services, health systems resilience, economic vulnerability, as well as emergent issues that more and more we want to think about. For doing all of this, we are reaching out to some of you to co-anchor the conference with us, and more as we go along to design these sessions and to sort of co-organize them, we reach out to many more. So in case if you think you or your teams might have the bandwidth or interest to co-host some of these with us, or you have things that you'd like to share or talk about during the conference, please feel free to reach out to either one of us, and we'd be very happy to have this conversation, particularly in the coming few weeks. This is the time where we're putting all of this together. So yeah, with that, I tell you about coffee hours, which have been more frequent, but now we really wanted to think about using them to uh, talk about particular things that were pertinent. Mental health again has been something that we've all thought about quite a bit, not just across respondents, but also mental health of researchers and so on. And while we were thinking about it, we thought it would be really useful to have at least one organization within the community share with us what they've been thinking about, looking at, and finding from the field. And once they do that, we want to think of our first presenter, Sangath, also as people or key persons that all of you can reach out in case if you have questions or clarifications on how to ask your questions and so on and so forth. So with that, I would like to pass it on to Madhavi and Ankur to share with us some of their findings from this one study that they'll talk to us about. Yeah, so I will stop sharing screens here and request Madhavi to try sharing screens. Thank you.
I am Madhvi Roy and I'm from Sangath, and I have with me my supervisor and colleague Ankur Garg also, and we are from the Addictions Research Group. And Sangath is one of India's leading mental health research organizations. And what we wanted to talk to you about over the next 20 to 25 minutes is about this longitudinal survey which we are running, which is called the My Wellness and COVID-19 survey, through which we are trying to understand the massive psychosocial impact of the COVID-19 pandemic and the accompanied enforced isolation on the mental health of people living in India, and how we are also trying to gather information on the kind of activities which people can engage in, which can act as mental health buffers, for lack of a better word, and which can, um, help them while isolating at home. And we began this survey last year in June 2020. And now we are in our seventh month of data collection. And through the course of this presentation, we will discuss a little bit about the objectives of the survey, about the kinds of questions we are trying to answer, and then we'll move on to the results, which will be shared by my colleague on this call. So I'll start. So yeah, like I mentioned, the survey aims to understand the complete impact of the pandemic and the social distancing regulations, which a billion Indians have been facing for the past 9, 10 months now, and on the impact this has had on their psychosocial well-being and social well-being. And these are the specific objectives of our study. Um, just to give you, I mean, of course, I know everyone on this call understands the context from which we are coming, but this was the COVID-19 pandemic was something which was absolutely unprecedented in the history of the world, and um, we do wish to find through this Pan India survey on how the different aspects of life have changed with the pandemic, from people's perceptions and experiences with COVID-19 to the extent of their worries, and also, of course, like I mentioned, the home-based activities people have been engaging in. And another very important objective of conducting this survey is that the Addictions Research Group, which is where we are from at Sangath, we hope to contribute to the existing compendium of public health research on this topic, and to also potentially help develop intervention programs to provide a more sensitive and evidence-based response to the unprecedented challenges which are presented by the pandemic. These are a couple of questions which we are trying to answer through our results. What are the psychological effects of this physical distancing? Why do some people experience worse mental health during the pandemic? For example, with respect to the second point here, we are also collecting data on gender and on the differential experiences of people who have, let's say, given birth during the pandemic, and so on and so forth. How are different populations being impacted? Which home-based activities can help alleviate mental distress? And like I mentioned, we do want to impact policy through our findings too. In terms of our study methodology, It follows a longitudinal design and utilizes a quantitative approach to analyze its data. And the respondents of this survey are English-speaking adult Indian citizens, and we have been continually recruiting them throughout the duration of the pandemic. And the information regarding our respondents' demographics, their health and health-related behaviors, social behaviors, and psychological traits, and everything else is collected through our survey. And like you can see on your screen right now, we are using measures like the satisfaction with life scale to measure subjective well-being, the patient health questionnaire to screen respondents for depression, the alcohol, smoking, and substance involvement screening test, also known as the ASIST, to investigate the frequency of use and associated problems with substance use, and finally, the perceived stress scale to measure people's stress levels. And further on, lastly, we are also collecting data on the kinds of activities people are spending most of their time on while isolating. Like I mentioned, adult Indian citizens residing in India is the demographic which we are targeting. I'll now briefly take you through a few of our respondent recruitment tactics. So, social media is, of course, the main source of our study respondents from the main source of our recruitment strategy. And we have only been focusing on organic outreach, as in we haven't taken the assistance of paid social media promotions, which of course has been a challenge, which Ankur will talk about at length when he starts with his part of the presentation. But yes, it's all been organic, and we have used a couple of different types of posters. We've used milestone posters, we've used study information posters, and we've published our survey results online. We've also tried to talk about mental health tips while people have been isolating in their homes. We've also engaged in a lot of collaborations with journalists and the media, because that is one group of people who can really get the word across about our survey and ensure that our response rate is high. So, for instance, our co-director of the addictions research group has engaged in a number of interviews with media houses throughout the country to ensure that our recruitment rate remains high. We've also published a couple of videos which talk about Sangath and Sangath's work in the field of mental health, because we do believe that, given the fact that we are a very well-known organization and we've done so much work in the past in the field of mental health, we do believe that that can also help out in reaching out to people in different parts of the country and ensuring that our study gets the sort of response which we need. This is the kind of data we've been collecting, and you can correlate this with the tools which I had discussed of a few slides prior to this one. And like I mentioned, this is a longitudinal survey, so it's a monthly survey. Each month, our survey respondents receive the follow-up surveys, and there is a very small difference between the baseline survey and the follow-up surveys. The difference being that demographics and health-related behaviors are only collected in the baseline survey, and in the follow-up surveys, we are only collecting information on the most important parameters we are looking at to ensure that people manage to fill out the entire survey and don't get daunted by the survey length. And I would now like to invite Ankur. And Ankur, let me know whenever you want me to, change the slide, although I'll be able to catch up, I hope.
Sure. Thank you, Madhvi. Thank you for giving that introduction and context to the study. Hello, everyone. I'd like to introduce myself. So I'm Ankur Garg. I'm an early career researcher, and I have been working with Sangath for the past 2 years now. And with Sangath, I've been working on various different fields pertaining to mental health and addictions, which we have come from the addictions research group. So our research is basically relating to the addictions field, and the mental health impacts of addictions on people, on population. So just to give you a brief, a little bit more context of why we are doing this study, I hope I am audible. Please let me know if.
Yes, Ankur.
Okay, great, thank you. Okay, please interrupt me in between if anyone has any questions till now as well. We can address them as we go ahead, or we can go towards the end and then can address questions at once. So just to give you a little bit more context of why we are doing such a study, an online survey, to understand, as Madhvi has mentioned, the psychosocial impacts of the pandemic itself and the enforced lockdown, which happened in India in from March to May, and how that kind of affected the mental health of people. As we know, with the advent of the pandemic, we have been studying the physical health effects on population, how COVID acts, how COVID is transmitted, how it affects people, what is the mortality rate, what is the morbidity rate, and what are the different symptoms. But as we experience with various in our day-to-day life, that uh, we see the physical health symptoms, we see the physical health effects of different diseases, different disorders, and address them as we go. But the mental health effects, the mental health uh, influences of different diseases is something that remains kind of unexplored, especially in situations like natural disasters, like the ones that we are having now, which is COVID pandemic. Uh, so Sangath, as a pioneer working in mental health in India, uh, we have been working on various fields for the past 25 years now. So this is something that we wanted to learn of how the pandemic itself affected people's mental health, and not just at that time of the pandemic when the enforced lockdown happened back in 2020, but also what are the long-term effects, because mental health effects are not something that are sporadic, but they continue sometimes for a longer period of time, and people are affected by them, and they in a number of times they go unaddressed. So through this study, through this longitudinal survey, we wanted to understand how the overall pandemic itself, how these different scenarios that occurred in pandemic, the enforced lockdown, the stigma, the fear of the pandemic, of someone getting COVID, their family getting COVID, someone dying from COVID, and fear among the healthcare workers as well, how that kind of affected the mental health of different population fractions, and what is the long-term effect and what is the long-term influence of these different scenarios, these different circumstances are on the mental health of people. So as Madhvi has also given you context of our methodology, we did conducted an online survey, which is still ongoing for residents of India. We wanted to study the pan-India effect of a pandemic and the lockdown on the mental health. Uh, so, uh, sorry. So, with regards to the methodology, we are using a number of tools to understand different parameters, different kinds of data. Madhvi, can you go back to the previous slide? Yeah. So we are collecting data on various different parameters. We are collecting about their social demographic information. We are collecting information about their health, their physical health as well, their psychological traits, their social behaviors, interaction with others, because that's one of the major things that's come out of the pandemic, because it restricted our interactions, our social interactions with people, with our friends, with our families. So how that affected, how the pandemic affected that, because that in turn will have influence over the mental health of people as well. We studied the effect of COVID-19 directly, of someone getting COVID-19, someone worrying about getting COVID-19 on people's mental health. We are understanding the prevalence, the effects of the pandemic on disorders like depression, on disorders like stress, on fear, on substance use, which is a major mental health disorder, which has been recognized by WHO as well. So we are collecting data on all these parameters. So this is a longitudinal survey, and we are collecting all the data at baseline, which we started back in June. and then when we are following that up on a monthly basis with our participants. So we are sending them monthly surveys to understand how the progression through the pandemic is influencing their mental health and different aspects of their lives. Madhvi, can you move on to the next slide? Yes, so we are following them up on a monthly basis for 12 months. So we are following them up for 1 year, and we have also plans to follow them up 6 months and 12 months post pandemic. So when WHO declares that COVID-19 is no longer a pandemic, we are also we'll also try to follow the participants up to understand the long-term impacts on mental health of people. So that's the overall context and what we have been doing and the kind of data that we are collecting. I'll be sharing in brief with you the descriptive data that we have collected till now. And one of the things that I would like to get your attention towards is the challenges that we faced uh, while organizing such a study, while hosting such a survey, because this is the first kind of survey that we have hosted at Sangath on a large scale and doing a longitudinal survey online. And as we might have experienced in different parts of our life during the pandemic and after the lockdown, and currently a lot of us are working from home, the technological implications on our day-to-day work, as we have experienced at the beginning of the meeting itself, which is technology playing its part and sometimes creating challenges which are unforeseen, but which we have to deal with in our day-to-day life. So Madhvi, can you go on to the next slide? Yes, so in terms of the data, the descriptive data from our study that has come out, so we have till now reached more than 1,000 people through our survey. So more than 1,000 people have filled our forms for the survey, have started filling this form, and we have covered uh, 31 out of 36 states and union territories in India. So we have participants from various states and union territories filling our forms, telling us about their mental health and physical health through this survey. So we have quite a representative population with us through this survey. An interesting observation is that more than 85% of this population who have responded resides in the urban strata of the population. And that is kind of coherent with the fact that this is an online survey and the reach will then be somewhat limited to those who have a smartphone or a laptop device or a computer device and have some level of digital literacy to fill an online survey. The average age for people who are filling our survey is around 33 years, but we have gotten people filling the survey as old as 73 years as well. So as I said, we have got quite a representative population through the survey till now. Next slide, Madhvi. As Madhvi mentioned, that we have collected data on gender, and we have included different genders data, including males, females, genderqueer, transgenders, and others as well. So most majority of our population is females who have filled the survey, with with 2/3 of our population being females and only 1/3, close to 1/3, being males. We also collected information about people's employment and whether they were involved or are involved in essential services. As we know, during the pandemic, during the lockdown, the only people who are allowed to move out of their houses were people who were engaged in various kind of essential activities, which included healthcare workers, which included people uh, who are involved in transportation of essential goods and services, such as food chain workers, such as government workers, and others. So that's something that we have also uh, collected data on. So as I mentioned, that we have gotten representatives from 31 different states and union territories. About 70% of our population are from the 5 major states/union territories, which is Delhi, Goa, Maharashtra, Karnataka, and Uttar Pradesh. Uh, and amongst Maharashtra, Karnataka, majority of these are from metros like Mumbai and Bangalore. So again, reiterating the fact that most of the population are from metropolitan cities, and uh, where people's digital literacy and access to resources are pretty high. Uh, Next question, Madhu. Next slide. Hearing response. So yes, that's another theme that we wanted to see, where we wanted to collect data on uh, because of the enforced lockdown. People people were locked down with their loved one, with their families, and a lot of people had caring responsibilities for different for their parents, for their children, for their other relatives, also for caring responsibilities for people with chronic conditions, which are vulnerable population when it comes to contracting COVID-19 virus. So that's as we can see, most of the participants have responded with having to care for elderly parents during the pandemic, with a lot of people also caring for minors and other relatives, especially India being a joint family culture. We often see people living in joint family structures, so uh, people have taken care of their relatives, other relatives apart from their parents and their children, including their grandparents and uh, other relatives as well. So health conditions as well. We have also collected information and data on what are the different kinds of health conditions that people have suffered from, be it hypertension, diabetes, which are the comorbidities that people are suffering from. Madhvi, next slide. Yes, that's another thing that we found out is we collected information on people, on people's perspective on being worried about different aspects of their life, because that's one of the things uh, that people are worried about and people fear is getting COVID-19 themselves. Uh, as you can see, people are moderately a little bit towards the higher end worried about themselves getting COVID-19, but not a lot of them are worried about dying from COVID-19, but contracting the virus. So that's another thing that we wanted to see, whether how people have perceived the changes in their life after the pandemic. So since our survey started after the lockdown was lifted, but the pandemic is still ongoing, and a lot of people were in June uh, forced to or are were required to work from home. These parameters also come into play of how people's life has changed pre and post pandemic, with a lot of people saying that the life has almost completely changed or a lot different from what it used to be in pre-COVID pandemic era. Yes, so as we can expect, people mostly were engaged in home-based activities, home-based hobbies, and including work from home as well. And there is less outdoor activities during that time, even after the lockdown was lifted. So I can see we have a lot of questions a few questions in the chat box. If I can complete the presentation, I'll try to address them after we go through our findings and the challenges bit. Yes, so another thing that we wanted to understand is how people's perception about their different aspects of their life, how people feel, whether they are in control or whether they are not in control of different aspects of their life given the post-pandemic conditions. So we collected information on different aspects of people's life, the common aspects, and rated them on a 5-point Likert scale. So as we can see from the graph, people said that they are very they are a majority of people said that they are not in control of their physical and mental health. So that's another interesting finding that was coming out to be through our results, is that a lot of people are saying that we are not in complete control of our mental health during the pandemic. And then that's an important finding for us, understanding that yes, people are recognizing that mental health in itself is something that needs to be taken care of, and that is something that is being affected during the pandemic, and the different scenarios that are happening during the pandemic. Yes, so these are the major three different mental health disorders uh, which have been highlighted in various studies that have come out, and which have been highlighted in, you might have heard in different talks, that the major mental health disorders that have come out of the pandemic are increased stress, increased anxiety, and increased levels of depression among people due to the enforced lockdown and the pandemic itself. So from our results, from our baseline results, we are getting uh, our findings are somewhat contrary to what other people are also looking at and finding, which is a majority of people are saying that they are suffering from moderate to severe stress in their day-to-day life after the pandemic. And these are just the baseline data. So this is the first point of contact for us with the participants. So this is just the baseline data, and we are getting a high proportion of people suffering from stress. A number of people are saying that they are suffering from mild to moderate and severe anxiety as well in their life. And if you look at the depression statistics, you can see more than 20% of people are suffering from moderate depression, and a good percentage of around 8% people are suffering from depression. As some of you might know, the national prevalence of depression in India is around 3%. So from our study, what we are getting now is somewhat, for severe depression, is somewhat around 8%. So that's something that we can clearly see from our study, that the depression rates are somewhat different from a point prevalence of depression in Indian settings. Okay, so that, I think most of our findings are descriptive at the moment, and we can see that people are so we collected data on whether people on their suicidal ideation or suicidal tendencies, and a number of people have mentioned that the number of, or the frequency at which they feel that they should harm themselves or resort to suicide as an alternative. Can you go on to the next slide? So we see here we have people suffering from moderate to high risk of substance use, including alcohol and tobacco. Next slide, yeah. So these are just the basic findings from our survey. I think I'm short of time. I'll just wrap up in the next minute or so. So what we are planning to do is, we are planning to send out descriptive statistics each month, and we also do bi-weekly reports to our survey. And towards the end of the study, we will produce academic papers and research doing analysis for the results that we are getting. But one of the things that I wanted to get your attention to is the challenges that we faced while hosting the survey itself. And these are pre-survey challenges, during survey, and what we are facing till now, and what we have faced, and what we have done in order to address those challenges. So one of the major challenges was the server issue that we faced before launching the survey itself, regarding the server security issues, because we were working on a new software, which is RedCap. That created a lot of problems for us, because none of us were experts in operating a new software, but RedCap was one of the most widely used and reliable softwares that we have. We have seen our collaborators using, and which we have searched through our scoping as well. Another issue that we faced a lot of times is the survey platform issues, and we have engaged with various stakeholders, with various contractors, to kind of figure out on a daily basis, to check for the surveys, how the RedCap is, how the platform in itself is working, how we can use the functionalities for a longitudinal survey itself. Recruitment is one of the major challenges when you come to an online survey, and this is something that we have faced problems with at different points of time, as we got a high recruitment rate when we launched the survey and reached out to a lot of people, but over the time the recruitment has plateaued a bit. But what we are doing is, we are revamping our social media strategies, we are revamping our dissemination strategies in order to reach out to a maximum number of people, and improve the reach of our survey to recruit participants. And something similar we are doing in order to address our response rates and dropout rates as well. Madhvi, next slide. Yes, so I mean, I think Madhvi, you will be better equipped to talk about RedCap in very brief, of what are the challenges that we faced. Very briefly, we have, say, 1 minute to discuss this.
Sure, Ankur. So, all right. So, RedCap is one of the most popular globally used softwares for conducting quantitative research. And the reason we selected RedCap is because universities all over the world, from Harvard to UCL to everyone, were using RedCap for their COVID-19 surveys. So we decided to do that because it was a platform which had been tried and tested. But what we did not anticipate was the fact that usage on RedCap isn't very intuitive. You do need dedicated support for using it, because the automations which RedCap requires are very detailed, very complex, and that is one of the reasons why our team faced a lot of roadblocks and challenges, because at each step of the way we had to figure out how to use RedCap on our own. So that's definitely something which hindered us at multiple points during the survey. I think that covers the issues which we faced with RedCap. I'm moving on to the next slide now. Let's see. Ankur, would you like to talk briefly about this?
Sure, Madhvi. So just to wrap up, so currently we are in the stage of recruiting people. So it's a rolling recruitment which will go on during the study period, and we are following up with participants. And as Madhvi mentioned earlier, we are currently in the 7th month of follow-up for participants who filled the survey in June. The next steps for us is to increase the reach of our survey, as currently we are at around 1100 participants. We are planning to improve our reach, revamp our dissemination strategies, and as a part of that, what we are doing is launching the survey in another language, which is Hindi, which is one of the predominant languages spoken in India. So we are trying to launch the survey in Hindi on RedCap, and we are hoping to get a wider audience for our survey through that. And the next steps would be to produce academic outputs in the form of peer-reviewed publications, as well as designing policy briefs in order to inform the policy makers about the findings that we have gotten through our survey, and that might help in the policy makers in formulating policies pertaining to COVID-19 and mental health. So that's it from our end. That's the study that we are doing and some of the initial results that we have received. We'll be happy to take questions now.
Great. Thanks, Ankur. Yeah, thank you for this. What we'll do is quickly go over to Sanghamitra, who's joined us from the Population Foundation of India, to speak to us a little bit also in terms of what their study surfaced. So very early on in the lockdown, PFI did a study on it was a rapid assessment on the impact of COVID-19 on young populations, particularly 3 states. So they looked at UP, Bihar, and Rajasthan. And maybe Sanghamitra, if you could speak to us about what were particular questions that you were looking at, and particularly around mental health. What were the questions? How were you able to ask them, and what were big findings from where you started? So over to you. Thank you.
Thank you, Rohan. As you rightly said, we conducted this study in the initial phase of the pandemic in May to assess the impact of COVID-19 on young people, the overall impact and challenges. Through the study, we were also trying to assess their knowledge of COVID-19 and COVID appropriate behaviors, as well as their health-seeking behavior in response to COVID-19. But and also the lockdown had resulted in interruption of access to reproductive health services. And since we work largely on family planning and reproductive health services, that's also something that we were looking at. But right now I'm going to sort of focus more on the findings pertaining to mental health, though that was a smaller quotient of the study. So this was a rapid assessment study. We had about 800 odd participants. We used purposive sampling. The participants were recruited through our NGO partners in these 3 states, in UP, Bihar, and Rajasthan, where PFI already has ongoing projects. Among the major challenges that young people faced, I would like to start off by highlighting that a lot of them reported an increase in anxiety, especially the adolescent population. The age bracket that we were looking at was 15 to 24 years. So almost 70% of participants in the state of Bihar and 30% participants on an average in these 3 states, they reported feeling an increased sense of anxiety pertaining to the financial situation and financial uncertainties surrounding the family. And a lot of male participants reported economic anxieties and uncertainties about their job prospects going forward. A little more than half of the respondents, they reported an increased amount of time that they were spending watching TV, or a quarter of the respondents reported increased social media use also. And incidentally, we found that there was a correlation between those feeling depressed and irritable, as well with an increase in TV viewership as well as social media consumption during that period. So that was one interesting finding. The other aspect that I would like to highlight over here is the increased caregiving burden, especially among the female respondents. Almost 50% of female respondents, as opposed to about 23% of male respondents, reported an increase in domestic responsibilities, particularly in doing domestic chores during the lockdown period, which also sort of reflects on the increased caregiving burden, often unacknowledged burden that women particularly face. The other thing that I would like to highlight here is that almost all respondents who said that they had accessed some kind of mental health resource, they found it useful. And they also expressed the need and desire to be able to access more such resources. However, a majority of respondents were largely relying on resources that they found online, or interactions with older people, or unverified resources, which also sort of mandates the need for availability of more such mental health related resources going forward. In terms of recommendations, the study recommended a greater training of frontline workers, who are often the first and only point of contact towards the health system for a lot of these rural communities, particularly rural women. And they are not just a source of services, but also a source of information, and can be a great source of mental health related information. The other big recommendation that the study made was on having social and behavior change communication strategies, which address the inequitable norms given the differential caregiving burden between men and women. And finally, the last big recommendation that the study made was to reimagine educational institutions. So almost none of the respondents they said that they had reached out to their educational institution, their schools or colleges, to get any kind of support or information in this period. And given the drastic shift towards digital medium going forward, there is a need to reimagine educational institutions, and not just have a fixed curricula or academic routine that they often use to educate students. I think they are also a very, very important resource and center for any information on mental health and any support that a lot of these young people need. So that's it for me. Thank you.
Great, thank you, Sanghamitra. That was packed but super useful, and full of really interesting findings. But maybe what we'll do is quickly go back to a few questions that there are from the group here, and maybe Ankur, Madhavi, if you'd want to take any of them, you also can feel free to maybe respond to some of these on chat if you feel like that makes it easier. Maybe I'll start with a question from Kuhika, who was just asking about how do you differentiate between genderqueer and others. So if you can, Madhavi, if you can just share what that breakdown was and what categories you use.
Sure, Rohan. So to answer your question, in the survey options which we had given, we have male, female, we have transgender male, transgender female, gender queer, pangender. So in order to, since the number of responses we get for the last 4 categories were quite small, we have clubbed them into other. but we have also given our respondents an option to write their own responses in case they don't identify with any of the options we've provided. And Rohan, should I also field the second question about family worries? All right.
Yes, please. Yeah.
So one very interesting finding which we found in our study was that people weren't worried about themselves getting COVID or themselves even dying from COVID in terms of, in comparison to how worried they were about spreading COVID to their family members. And that was just off the charts. So I think that was one thing which we found very interesting, that family members getting COVID was the highest, was the greatest worrying factor, even more than financial worrying, getting COVID yourself, dying, and everything else. So yeah, that was one really interesting finding. I'm just reading the chat if there's anything else. I think the other questions are for Sanghamithra's presentation. Hello, can you hear me, Rohan?
Hello.
Yes,
Yeah,
yes, I
I
can.
actually just responded to Priya's question on increase in domestic violence, which is something that we did see in the study. A fourth of the respondents, they witnessed an increase in domestic violence at home, though this wasn't their first-hand experience. And I will certainly share the report.
Yeah.
We did probe. No, we did have a question on domestic violence in the study.
Right. So there's a question for the Sangath team on health behaviors, which, yeah, Shyama, if you could just please unmute yourself and maybe if you want to ask the question to Madhavi and Ankur.
Thanks, Rohan. So I just wanted to understand, there was one objective which mentioned to examine how health behaviors are affected by social isolation, right? That is one of the specific objectives that the Sangath team had listed. I was wondering how information was collected on that and what came out of it.
Thanks, Shama. Thanks so much. So to answer that briefly, and Ankur can add on if I miss anything. One of the questions which we had asked was about whether people have been seeking support for their mental health, and if yes, then what sort of support they were seeking, whether they were talking to a psychotherapist, whether they had visited a psychiatrist or a counselor, whether they were taking medication. So that is one aspect in which we were seeing if health behaviors were changing over the course of the pandemic, as mental health data became more worrisome, so to say, were people actually seeking out the help they needed. Ankur, have I missed out on anything? Let me know.
Yeah, thank you, Madhvi. So another thing that we also explored during our survey is the health behaviors, including alcohol and tobacco use. So we explored how people's behaviors, people's habits of alcohol and tobacco use are were affected during the lockdown and after the pandemic. Because, as you know, after the enforced pandemic, enforced lockdown, the access to these substances like tobacco and alcohol was restricted for people. So we try to understand during the pandemic if how people's behaviors were affected due to that. Not only theirs, but also their family members' behaviors. Of if someone in their family also tried to access any substance, tobacco, alcohol, or drugs as well, and did that affect their social functioning? Because when you use, so the tool that we use, assist, also explores that whether the frequency of you using substances, the frequency of someone using substances, and whether that affects or influences your social functioning and regular day-to-day functioning as well. So that's something that we also explored during our study, is how the pandemic itself affected their substance use behaviors. Does that answer your question, Shama?
Yes, it is. Thank you so much.
Okay.
Can I ask one more question which is related to it, that is kind of bugging me? But if
Yes,
it's
please.
outside the scope of the discussion, please forgive me. I just wanted to understand, once you have these findings, so these are very important things that you're trying to find out, right? How the health behaviors are influenced, and how people act when they can't really get to what they previously had access, etc., right? So will you be trying to find some sort of association between, okay, what caused this kind of behavior? Was it just the isolation? Was it just the stress? Would that kind of efforts will you be attempting something of that sort also?
Yes, Shyama. So definitely we will be trying to understand the associations between different factors as well. Since this is a longitudinal survey, we will also be studying the trends of behaviors and the trends of activities and different parameters uh, during the follow-ups of the study, as we are collecting some data which are pertaining to basically their health behaviors, their activities, which also varies as we go ahead, like uh, and their worries and their mental health status, which includes their depression status, which includes how much stress they are, or if they are feeling anxiety, and how that has progressed through time. So that's something that we will be exploring through our follow-up surveys. Does that answer your question?
Sure. Thank you very much.
Okay, great.
Yeah, but thank you, Syama. I totally hear. I mean, what the potential for such an inquiry can be. Then, and maybe we can find out if if more follow up sort of sessions could be set up with maybe uh, with the Sangath team and the data that they have, and exploring the possibilities of other people synthesizing on top of that. Maybe that could be a useful thing to think about. I had a question for both the teams from Sangath and PFI, and I'll do that before I head to the next set of questions. Uh, when you do diagnose, or when a respondent says they are suffering from anxiety and depression, how is it that you what is distress redressal mechanisms, and do you recommend people to use resources? How do you follow up? What is the protocol that you were able to set up? Yeah, across both your studies.
Sure, Rohan, thank you. I'll take up that question first. So, Rohan, just as to kind of correct you briefly, we are not diagnosing people who are suffering from mental health disorders. We are identifying them. So there's a difference between identification and diagnosis, because diagnosis will mean a clinical diagnosis, which can be done by a clinician or psychiatrist, right? What we are trying to do is using standardized tools, which have been standardized for use in various populations across the globe, in identification of people who might be suffering from depression, who might be suffering from high levels of stress or anxiety. So what we do with anyone who through their questions, through their self-reported questions, have been identified to suffer from any of these mental health disorders, towards the end of our survey, we have automated responses where we provide resources to people, different resources across the country, helplines and free resources, which they can explore. In addition to that, what we also have set up is a system where one of our counselors here at Sangath, who have been trained for various years and practicing delivering counseling services, we have given their phone number for redressal. If someone is in immediate need of mental health and wants to understand more, wants to seek help, we have that number in our information sheet and consent form. And that number is active during the office hours, and anyone who wants to get help can call that number, and we can, if it's possible over a phone session, we will try to do that. Otherwise, we will refer them to a clinician, a psychiatrist near their place.
Right.
Rohan, in our study, unfortunately, in the rapid assessment study, we did not have any such provision of redirecting the respondents to resources on mental health. However, in a separate program that we run, this is a behavior change communication program that we have. We have a digital extension of that program, which is this AI-powered chatbot embedded on the Facebook page of the program, which provides information on sexual and reproductive health. That has a lot of traffic and a lot of young people who who come in, who talk about their mental health situation or undergoing depression. So there we do have a pool of resources and helpline numbers that we sort of recommend to them that they can be redirected to. But unfortunately, that was not something that we did as part of this study.
Right. Okay. Thank you. Nishmeet has a question here in terms of adaptations during measurement, particularly when it went either on the phone or web from the time that you were doing it in person. What were the kind of adaptations that you found yourselves doing? Both of you, I guess.
Sorry, I didn't quite get that question.
Maybe Nishmeet, do you want to repeat your question?
Sure, Rohan. Thanks. So my question basically is for both the presenters, basically trying to understand when mental health questions in general can be difficult to administer, right? They are sensitive and it's difficult to get the right response, and that's why you use validated instruments. But what we've seen in the context of COVID-19 is some of these validated instruments have also been adapted somehow by researchers to for phone surveys or web-based surveys. So just wanted to understand whether that sort of thing went into what was the thought process, and if there was an adaptation that was done to these validated instruments in this case.
So thank you, Nishmeet, for your question. Our study primarily did not focus on mental health. It focused on the overall impact of COVID-19 on young people. So at that stage, we had a lot of questions on whether they had accurate information about COVID, whether they were actually reaching out to a health professional if they had the symptoms, or overall what challenges they were facing. So the mental health question or questions surrounding increased economic anxieties or increased workload, they were sort of part of that overall framework. So we weren't specifically focusing on mental health related questions, if that answers your question.
Yes, Madhavi, please go on.
Follow up with So to answer very briefly about your question, we didn't particularly adapt any of the validated instruments we used, but one thing we did do is at the end of every page where we felt that we were collecting information which might potentially be distressing, we had the number of our counselor and we have the link to a couple of mental health resources. And that's the only adaptation which we did to ensure that as much as we can, we could reach out to people who were feeling distressed because of the survey.
Thank you. Yeah, Nishmeet, I guess we'll also just look this up maybe, yeah, and get back to you in case if we find examples of cases where people were able to adapt, particularly other distressing questions and what changes. So maybe we do that offline. Great. Thank you, Madhavi and Sanghamitra, for your responses. Are there any other questions or thoughts that anyone from the audience would like to share?
Hi, I just wanted to add because with the SMART study, the first study that was presented, I think the number of women respondents were much higher. So I don't know if you have the data of how, the work from home and presence of men at home contributed to increase in the perceived stress, because that's something that we were linking in our study. And because yours is a co study, I think it'd be interesting if going forward you could do that.
I'm sorry, was that for the PFI study or the
No,
Sangath
that
one?
was for you, Madhvi, for the Sangath study. So if there were any correlations found between the increase in work from home and that leading to increased presence of men at home and in perceived stress of women?
Unfortunately, we haven't looked at that.
Okay.
Yes, so Monisha, just to comment here, we have not specifically looked for that. So going forward, what we will be doing is we'll be doing association analysis. That's something that can come in is because we have the data of who's working from home, we have the data of gender. We can definitely look it up, but I'm not sure of the validity of such data, because we are trying to look at something which is not the primary focus of the study.
All right.
Yeah.
Thanks for that.
But definitely, I mean, that's an interesting thought. And if you'd like to know further, I mean, get in touch with either Madhvi or me through our Sangath contacts, and we'll be happy to disseminate our findings with you. Okay?
Sure, I'll do that. Thanks.
Are there any other questions for either of the presenters, or any reflections that you may have from your own practices? Maybe if there are any challenges you faced when you're asking questions around mental health or distress that you'd maybe want to share for the Sangath team to field?
I can add a very small, interesting thing, one interesting response which we received from our respondents. So, like Ankur mentioned, there is a scale we've been using called the assist scale, which looks into substance use. So, from a number of respondents, we received, because at the end of the survey, we've given a sort of end screen text for the respondents who scored above a certain threshold on their assist scores based on their consumption of alcohol and tobacco during the pandemic. And from a number of respondents, we received messages saying that they felt they didn't feel comfortable reading that because especially during the pandemic, because substance use levels have gone up. They didn't want to be confronted with that information, so to say, and they didn't want to read that. They didn't want to, because things were already tough, at home, at work, with their mental health. And sometimes knowing that your substance use levels are what WHO classifies as high is not something people want to know about. That was just something interesting which we found out.
Right. And if this was a quantitative survey, like how were you able to get this? Again, maybe I might have missed this, but like, was there a place where they could add pieces of text?
No. So the assist has like various questions which look into your frequency of use, if you've faced any impairment in your social functioning, in your work life, if you faced any legal issues because of your use, if your family members have any voiced concern for you because of your use, and if you mark yes or no, depending on your usage to any of these responses, the assist scale calculates a cumulative score for you and places you in like a category of low, moderate, high substance use.
Interesting.
Yeah.
Are there any other questions and thoughts for the speakers? All right, maybe then if there's nothing, I'd like to firstly thank Madhavi, Ankur, and Sanghamitra for all their time and putting their presentations together and sharing them with us. I think this conversation around mental health is also an ongoing one. We'd like to work with them further to develop some of this thinking, bringing it back as potentially resources that we also share at the conference, or think about how we'd want to share it with the wider community. So keep an eye out on that. I again thank you all for your time and for all your thoughtful questions and engagement. We'll be in touch over Slack and email in the meanwhile. If you have any thoughts, questions, suggestions for us to program at the conference as we prep towards it, please let us know. And we'll be back in a few weeks with the next coffee hour, and we hope it would be engaging and exciting. So thanks again for all of your time, and have a good evening.